Hi everyone, my name is Kristen Conrad. I'm going to be walking you through the sueur's benefits for 2026. Give me just a moment here. I'm going to share my screen and then we'll go ahead and run through all of your benefits. Okay. My name is Kristen Conrad. I'm with Assured Partners. I am your account manager with the insurance broker Assured Partners. Every year we take a look at sueur Incorporated's benefits and try to bring the best quality benefits to all of you for the most affordable prices. Jumping right in, what is open enrollment? It's the one time per year where you can make elections and changes to those elections for your benefits. You can add dependents, you can remove dependents, you can update all of your contact information, you can change your beneficiary. In regards to life insurance, this is something you want to make sure you have updated. We understand, divorces happen. If you've never filled out a beneficiary form and something was to happen to you, none of the life insurance money would go to your next of kin if you don't have that beneficiary form completed. Any other time, changes can happen throughout the year. Our qualifying life events. These are things like, hey, I got married, I had a child, maybe somebody, you or a spouse loses their employment. Those are qualifying life events. You can make changes to your elections, but you only have 30 days to do so. And that is when you need to speak to your HR. If you did get married or had a child or something like that, maybe you got a divorce, there is some required paperwork, such as like a birth certificate, a marriage license, that your HR would need just to ensure that we are covering the right people under the plan. As far as your open enrollment, it is starting today and it will end Saturday, November 29th at midnight. What are we going to talk about today? We're going to go over what's changing, what benefits is sueur offering you, what are those costs going to be, and then what do you need to do next? The medical and drug benefits. So I know you had in the past several plan options. This year, there are two plan options, a PPO plan and an HSA plan. The medical is moving to UMR. The prescription drugs will be through Optum. These are both still part of United Healthcare, like Medica. We do not predict a lot of disruption. But that being said, please make sure that you're checking your doctors, you're checking your medications, and making sure that all of those are still covered and in network. Your HR has more information on that. If you're sitting in the audience thinking, hey, which plan should I sign up for this year? PPO plan has copays in regards to a primary care office visit, a specialist visit, and then medications. Usually because of those copays, you're going to pay more per pay for that PPO plan option. And those copays, you kind of know what you're paying. The HSA plan is going to be cheaper per pay, and you're going to pay towards your deductible. So there are no copays with that HSA plan. So keep that in the back of your mind. Taking a look at the deductibles, coinsurance, and out-of-pocket limit, those are the first three numbers listed there for you. So I'm going to talk about the HSA plan because that's what I'm currently enrolled on. So me, myself, say that I am enrolled as a family on the HSA plan. Your plans are embedded. That means they have a richer benefit. So even though I'm enrolled as a family, there's that $6,600 deductible, family deductible. If I already met for myself $3,400 of medical expenses, they were in network, everything was covered, and say I got a upper respiratory infection and went and saw my doctor today, the cost of that visit would be toward the coinsurance. The 80/20, I would be paying the 20%. Because I've already met that individual deductible. Even though I'm enrolled as a family, you only need to worry about your individual deductible with these plans. Once you've met that individual deductible, then you pay that next 20% until you get into your annual out-of-pocket limit. So it's $12,000 for a family. Another way to look at these numbers is my husband and I, when we sit down and look at benefits every year, we do talk about, this maximum out of pocket or this annual out of pocket number. This is your worst case scenario number. So this means if you're at the doctor every single day, everything is covered and everything is in network, that is the most that you're going to pay for services. Moving on to the prescription drugs, as I mentioned, it's with Optum this year. The PPO plan, again, like I said, there's those copays for the generics, the brands. You also have specialty drugs and non-preferred that's covered as well. HSA plan, all of that's going to run towards your deductible. Once you've met that deductible, then you're going to have that co-insurance amount. Please keep in mind that the retail drugs, which are the pharmacy, you run to the pharmacy, it's a 31-day supply. The mail order drugs is going to be a 90-day supply. Medical premium costs, the costs are broken down for you right there. Regarding the HSA or the high deductible health plan, as I mentioned, it is cheaper per pay than that PPO plan. Your per pay costs are listed there for you. And then if you were to enroll in the HSA plan, the sueur actually makes a contribution of $500 to your HSA account as long as you've set it up with ThrivePass. And then $1,000 for anybody who enrolls as Employee Plus One or Employee Plus Dependents. So keep that in the back of your mind. That's free money that sueur is giving to you to help pay some of the costs of your medical bills. There's also a Samaritan Fund program that can help people with very severe chronic conditions at no cost share. If you'd like more information to learn about that and what those options are and if that applies to you, there's a phone number here, a website, and then you also have a handout with your benefit guide as well. Regarding medications, specifically specialty drugs, there is another program called ElectRx. And so it is no cost to you. It is outsourcing medications to pharmacies in other countries, such as Canada, where the cost of these medications is actually could be half or a quarter of the cost. And so there is information of which drugs those would cover. But keep in mind that you do need to fill your medication with the plan. So through Optum first, at least once before you use the ElectRx option. Some resources available to you is UMR online, and they also have an app that you can put on your phone if you would like. Personally, I don't like everything on my phone, but I do use the online version. What you might use the online website for is explanation of benefits. This is a summary to you that says, hey, your doctor and your insurance company processed your claim. Here's what you owe. You should actually not pay any of your bills until you've looked at your EOB to make sure that it's processed through insurance. If you say had a doctor's appointment today, it can take the insurance company up to 45 days to process and pay that claim. Most people were just paying bills because they're being handed to us by our doctor's office. And I'm trying to help you, save some money here because there are a lot of mistakes and things that happen at the doctor's office and at the insurance with medical services and coding and things. So you can access those EOBs through your UMR online resource or on your phone. You can also access a digital copy of your ID card. So say you leave your wallet at home, you can also see in the app real time where you are with meeting your deductible. So maybe you're at the pharmacy or you're at the doctor's office and you're like, hey, I think I met my deductible, but I'm not really sure. You can pull that up on your phone. You can also message or email a person directly at UMR to ask about procedures. Hey, I'm having this surgery. Is it covered? How is it covered? Has my doctor submitted a prior authorization? All of those things. So you don't have to sit on the phone and call the 800 number and hope you get to a person quickly. As far as finding a provider, you all can either use UMR online or you can use United Healthcare. You want to search for the Choice Plus network. It's their most expansive network that they have nationally. You want to make sure that your doctor and the physical location are both showing in network. A lot of doctors today have several doctor's offices locations. If you see your doctor on North Main Street, when you search their name, Dr. Smith, you want to make sure that that North Main Street location is showing on the website. If it's not, then that could be out of network. If you go out of network, there's no controls on pricing because there isn't a contract with the insurance company. So you could get a very costly bill. So if we can try to stay in network, that's going to be the best and the cheapest option for all of you. As far as what other services does UMR offer, they have a condition care program. These are for maybe more complex conditions. You'll have like a dedicated nurse, manager who might go through, like your doctor might prescribe a new medication and maybe it's not working so well for you, but you can't get into the doctor right away. So you could reach out to this condition care line. The nurse can take a look at, the treatment options and your information and maybe get back to you on, talking to your doctor and what other treatment options or other medications you can look at. As far as care options, we're getting into flu season, and I'll be honest with you, it's really hard to get into your primary care doctor. I know for myself, I only see my primary care doctor maybe once or twice a year for my physical exam and then my blood work. I'm usually utilizing Teladoc, and I'll be honest, I'm not big on technology, but Teladoc is really quick and convenient. Um, I woke up at 2 o'clock in the morning and did have an upper respiratory infection and was able to get a doctor's visit within 30 minutes of requesting that. And this was at 2 o'clock in the morning. And then that doctor sent the medication directly to my pharmacy, and I was able to get that right when they opened. I didn't have to think about, like, do I have to take a day off of work to get into my doctor? Will I be able to get into my doctor today? Those kind of questions. So it was really quick and easy. I will tell you with Teladoc, you should register now on your phone or download the app. It can take about 10 to 15 minutes to put all your information in. And so it'll be quicker for you if you'd ever need an appointment. That is your cheapest option as far as care. Then, in addition to your primary care doctor as well, then you have those convenience care clinics. So those are things like a little clinic in your grocery store. Then urgent care is going to be the next highest cost. And then emergency room is going to be the highest cost you will pay. I will tell you that if something happens on the weekend and I'm not really sure if it's ER or urgent care, I might call urgent care or show up first just to get their thoughts on it before I go to the emergency room. The emergency room is going to be, more severe in nature. So, like chest pains could be a heart attack or something like that. So that would be more emergency related than maybe an urgent care. Also, just a reminder that if you are having a surgery or something like that, don't just depend on your doctor to reach out to your insurance to see what you need to do. If something is approved, like a surgery, or denied, the insurance is going to send a letter to you indicating, hey, there's an approval on file, or no, we need more information. I've seen situations where patients have gone into a surgery and nothing has been pre-authorized, and then it denies later with the insurance company, and that's something the patient has to sort out later. So knowing ahead of time, hey, I'm going to call my insurance or I'm going to get in on UMR's website. I'm going to send a quick message about my surgery to see if my doctor has started the prior authorization process or if I need to do that. So just keep that in the back of your mind as well. As far as things that can help you pay for these medical services, LeSueur does a really great job with their health savings account, an HSA. You can have this account if you sign up for that high deductible health plan. If you're on the PPO plan, you cannot have an HSA. So please keep that in the back of your mind. You can't contribute to the HSA, I should say. And then the limits, everything with the HSA is pre-tax. There is a limit. So that limit is $4,400 for 2026 for anybody with single coverage, $8,750 for any other coverage. And then please keep in mind that LeSueur does contribute $500 for an individual and $1,000 for everybody else. You will need to subtract those totals, and that information is listed there for you. If you're 55 or older, you can contribute an extra $1,000 of catch-up money. And then all of these accounts are through ThrivePass. If you have not set up your account, please make sure that you go ahead and do that so that you don't lose out on the free money here for your medical expenses. As far as the money that's going into these accounts, you also can invest the money that goes in your HSA to grow it. And that way, next year you might have $3,000 or whatnot. So that's something that's available to you as well. Please make sure with the HSA money that you are using that for HSA eligible expenses. Things like a wheelchair or crutches or medications, not for things like your cell phone bill or anything like that. A flexible spending account, this is for people on the PPO plan. It's also through ThrivePass. FSA accounts are a little bit different. These are employer owned, where the HSA, if you were to leave LeSueur, that is your money. It would go with you. The FSA is not like that. The FSA is use it or lose it. So if you don't use it by the end of the year, it's gone. It essentially is not yours anymore. Also make sure that that money is being used for those HSA, or I'm sorry, yes, the eligible expenses. You can also carry over $680 to the next plan year to prevent loss of those funds. But if you leave LeSueur, that's where you would lose access to the money. Dependent care accounts. These are accounts to reimburse you for care for your dependents with pre-tax dollars so that you can go to work. So this money is for like daycare. It's not for, a babysitter watching your child on Saturday night. This money is pre-tax. There are limits. Those are listed there for you. And then it is use it or lose it by the end of the year. If you take a look at the chart, going through an example, so you might be sitting here thinking, well, why would I ever give money into this account? Somebody who makes $40,000 a year maybe contributes $2,000 to the account. It actually lowers your taxable income because you're contributing. So if the average tax rate is 25%, you actually end up saving $500 by utilizing this account. So just something to think about, especially because we're coming up on, time to file taxes and different things, or for next year, it might be something to think about. Dental and vision benefits, you have 2 dental plans that are being offered to you. There's a core plan and a buy-up option. Both of these are through Delta Dental of Minnesota. You have a deductible. It's $50 a person or $150 for 3 people. If you have 4 people, the maximum is still $150. Your maximum benefits is $1,000 for the core option and $3,000 for the buy-up option. Essentially, what that means is the buy-up option is going to have more benefits to it, but you're going to pay for that. If you take a look at the chart below, the buy-up option is nearly 4 times the cost of the core option. But if you're thinking, hey, I need to get a lot of dental work done and I've kind of been putting it off, it may make sense to get the buy-up option this year so that you can get that dental work done. As far as preventive services, those are covered in full. Preventive means just those regular screenings, the cleanings, the exams. When I say regular, I mean, 2 cleanings a year, once every 6 months. If you're having 6 cleanings a year, it's not after the 2 every 6 months, it's not going to be covered. So please keep that in the back of your mind. Basic services is going to be covered at 80% as long as you're in network. Major services is going to be covered at 50% as well as long as you're in network. If you are interested in child orthodontia services, you want to take the buy-up option because you have coverage for that. The core option, you do not have ortho for children, and that is up to age 19. The vision coverage, it is through VSP. A couple of things to talk about is also with your dental and your vision insurance, make sure you're looking up your dentists and your ophthalmologists. Very frequently, I've seen dentists go out of network and no longer take insurance, especially nowadays. And it doesn't just happen every January, it happens throughout the year. So maybe like a week or 2 before my appointment, I'm looking at the website on Delta Dental and making sure, hey, my dentist is still in network, right? So make sure you're doing that. Also with vision, keep in mind the frequency. Routine eye exam is once every 12 months. If you get 2 vision exams, only one is going to be covered. The eyeglass, so the frames are going to be once every 2 years, and then the lenses once every year. Your costs are listed there in the bottom right-hand corner. That's per pay. Other benefits that you do have an employer basic life. It's $25,000 for every single person. Please make sure you're updating those beneficiaries, just because I really think it's important. I want the money for all of you to go where it needs to go. So please make sure you're filling those out during open enrollment as well. Your voluntary life, that's through the standard along with your basic life insurance. The voluntary life, if you're thinking, why would I purchase extra life insurance? Normally, I guess my thoughts is my husband would be devastated if I passed away. But in addition to that, we are now down to a single family income. And so I think about, the house payment and this and that. My husband's going to be worried about all of these things. So normally people are buying additional life insurance to pay off their house. So their spouse or whoever is left behind doesn't have all these things they have to think about and on one income. Other people might think about, hey, maybe I'll add some extra life insurance money for my child for college, or an investment option or an inheritance for my children. So just some things to think about. As far as the voluntary life insurance, it did go up to $200,000 for the guaranteed issue amount. The costs are listed at the bottom for you. Also, in regards to the voluntary life, which is through the standard, you can increase the amount of you and your spouse's life insurance by $10,000 increments, up to 2 of those, so up to $20,000 without EOI, up to the guaranteed issue amount. So once you go past that guaranteed issue amount, then you will have to do the medical questions, which is the EOI. I will say with those medical questions, usually they'll mail you something to your house, the standard, and then you'll need to either fill it out or take it to your doctor to complete. And then it has to go back to underwriting at the standard, and they have to give an approval or a denial. And so you'll receive a letter. Everything is not auto approved. So keep that in the back of your mind as well. Just because you send the information in doesn't mean you automatically get it. In regards to short-term disability, this is through the standard as well. Please keep in mind with short-term disability, this is an income replacer. So this is for, injuries or something that might happen off work time. And so it could be something as, hey, I tripped down the stairs and broke my ankle, and I'm a line worker at a manufacturing company, and I can't physically go to work, but I still need an income. So you would want to have short-term disability to be able to give you payments while you're going to your doctor's appointments and going through physical therapy or rehab and different things. So sueur actually pays for everyone's short-term disability coverage. And if you take a look here, there is like somewhat of a waiting period depending on the circumstances. The benefits will begin the first day after the injury, but the 8th day after an illness or pregnancy. It's going to be 67% of your earnings up to a weekly maximum of $700. The cost is down at the bottom. Then as far as long-term disability coverage, that is voluntary. So you do not have to sign up for it if you do not want to. It is with the standard. These are for more serious conditions, such as, maybe a cancer diagnosis and you need to go to chemo. And so during that time, you may or may not be able to work. And so that's what this is for. This is also an income replacer as well. It's 60% of your monthly earnings, and there's more information in your benefit guide. Also, keep in mind that there are pre-existing condition limits. So there's a 3-month look back to where if you've been, diagnosed with anything that could be of interest while you're applying for this coverage, you may be denied these benefits. Worksite benefits. So you do have accident protection. You can get accident insurance on yourself, your spouse, or your child. The conditions are all listed there for you. There's even more than that, but I just wanted to give you an idea. The costs are listed there for you. These are different than short-term and long-term disability. This is more of a one-time payment for an accident. So keep that in the back of your mind. It's not going to be an income replacer, but a one-time payment. Critical illness, same kind of thing, but it covers different conditions. These are going to be more severe, cancer, coma, stroke, heart attack, paralysis, and these are also one-time payments as well. And you can get these benefits for yourself, your spouse, or your child. The costs are listed below for you. And then hospital indemnity. This again is that one-time payout for, maybe you're hospitalized due to like a heart attack or something. There are limits on these. So, hospital admission in lieu of ICU, 1 admission per calendar year, and it gives you $500. The costs are listed down at the bottom for you as well. Very briefly, I'm sure you've already heard, there is a Minnesota paid leave that is coming your way, and there should be more information from HR that's coming as well. You can scan this QR code or go out to the website to learn more. We just wanted to include some questions and answers for you to kind of give you an idea of what it is and how it might work. EAP, Employee Assistance Program. A lot of people think that this has to do with mental health services, and that is, one piece of this. Some other EAP are things like maybe you're having stress or anxiety with work, or financial or legal concerns. Maybe somebody has stolen your identity. Maybe you need help preparing a will or other legal document. And so the standard is providing this to all employees. It is free. You have 3 free visits at the bottom. You can reach somebody by phone, live chat, text, or email at the standard to get these services that you need. There's a phone number at the bottom, or you can visit their website to go ahead and get started. As far as how do I complete my benefits election, every single employee will need to go out to ADP. The website is listed there. Every single employee needs to go in, needs to complete their elections and sign off on everything by Saturday, November 29th by midnight. If you have any questions, my phone number and my email are listed here for you. Thank you so much and have a great rest of your day.